Good afternoon, everybody. President, members of Council, Deputy Vice Chancellors, Deans, faculty and guests, it's a real pleasure to welcome you to the Sir Charles Cameron Award for Population Health. I'm particularly delighted to welcome this year's recipient, Professor Agnes Binagwaho, co-founder and former Vice Chancellor of the University of Global Health Equity, who will be formally introduced by Foundation Head of the School of Population Health, Professor Ed Gregg. This award was raised to mark the establishment of the School of Population Health here in RCSI in 2021. Previous recipients were Dr. Mike Ryan, former Executive Director of the World Health Organization Health Emergencies Programme, Professor Andrew Morris, CBE Deputy Head Director of Health Data Research UK. And can I take this opportunity to congratulate Professor Gregg and his team at the School of Population Health on the outstanding success of the school as it goes from strength to strength. If you forgive me, I'd like to particularly call out the leads in the school for their contribution to its success. Dr. Barbara Klein from Public Health and Epidemiology, Professor Kathleen Bennett from the Data Outcomes Centre, Professor Juan Carlos and Eric O'Flynn from Global Surgery, Professor Jan Sorensen from the Health Outcomes Research Centre, Professor Mary Clark, who leads the SPHERE programme, Dr. Sarah Berry, Deputy Head for Education, Elaine Healy, Research Manager, and Brian Lynch, Operations Manager. I'm also really pleased to welcome here today our incoming head of the School of Psychology Unit, Professor Niall Pender, on his very first day at RCSI. So warm welcome, Niall. This award ceremony honours the memory of past President Sir Charles Cameron, who made it his life's work to improve the health and well-being of Dublin's most vulnerable inhabitants at a time when infectious disease was rampant and mortality rates among the city's poor were amongst the highest in Europe. He served as Chief Medical Officer of Health from 1879 to 1921 and simultaneously held the Chair of Public Health in RCSI from 1868 to 1920, using this platform to educate and influence future generations of healthcare professionals in the area of population health. His efforts focused on housing and sanitation, public education, and food safety. Cameron's ceaseless efforts saw the death rate in Dublin decline by a quarter between 1901 and 1911. Serving as president of RCSI in 1885, a true polymath, ahead of his time, he epitomised the One Health concept. Writing in 1892, he said, and I quote, "The medical officer of health will be something more than a physician and a surgeon. He or she will in a sufficient degree be a bacteriologist, a chemist, a veterinarian, a geologist, an engineer, a statistician, and as so far as sanitary statute are concerned, a lawyer." I think it's entirely fitting that we associate his name with current and future leaders in the field of population health. The award, which you can see centre stage here, is Bunsen's Flame by Jason Ellis. It brings things full circle, commemorating Cameron's pioneering work as a chemist. RCSI itself, our mission is to educate, nurture and discover for the benefit of human health, is rooted in equity. As signatures of the UN Sustainable Development Goals Accord, we're dedicated to fostering improvements in communities, local, nationally and globally, to deliver real change and to improve the health of populations. We are proud to be ranked number 1 in the world for UN SDG number 3, good health and well-being. Looking into the future, you might have noticed our new building at 118 St. Stephen's Green, which many will start moving to this week. This is RCSI's brand new state-of-the-art building with the ground floor featuring a new public engagement and exhibition space. And through a rolling program of exhibits, events, and online activities, this space will be a place for everyone to join conversations about living longer, healthier, and hopefully happier lives. The first exhibit will start in spring 2026. It's now my great pleasure to invite to the podium Professor Ed Gregg, Foundation Head of our School of Population Health.
Thank you, Cathal, and good afternoon, everyone. It's great to see such a great turnout here. It's really a great privilege here to welcome you to the 2025 RCSI Charles Cameron Award Lecture. This is an occasion that celebrates excellence in leadership, in population health, and as part of this, we're deeply honored to recognize Professor Agnes Binagwaho. She's a remarkable physician, educator, and leader whose life's work has transformed health for millions in Rwanda and actually globally. Now, Professor Binagwaho is a Rwandan pediatrician, and she's a global health pioneer. She's born in Nyamagabe, is that right? In Rwanda's southern province. And she began her journey in medicine actually in Belgium and France. But in 1996, 2 years after the genocide against the Tutsi, she returned to Rwanda, and this is really when I think that really a remarkable part of her history really begins. She returned to Rwanda at a time when basically all of society had been torn apart, and as you might imagine, the health system with it. And over the following 2 decades, she served her country with extraordinary dedication, conviction. She became executive secretary of the National AIDS Control Commission, and then became permanent secretary of Rwanda's Ministry of Health, and then ultimately the Minister of Health itself. Under her leadership, Rwanda became a global example of what can be achieved through vision, data, and an unyielding commitment to health equity. And if you like to read health statistics like I do, you see that Rwanda is actually really a remarkable story. If you go to 1995, Rwanda had perhaps the worst health statistics in the world if you look at key things that we look at, such as infant mortality, child mortality, youth mortality, life expectancy. And in the 30 years period, really in the 20 years that followed that, we've seen actually Rwanda as one of the remarkable success stories in Africa and the world, actually, wherein all of those metrics have gone from being the worst in the world to among the best in Africa, among the best of low and middle income countries, and really is now on a par with the rest of the world. And so with this dramatic reduction in child and maternal, this was done through really a unique multimodal approach that I think you'll hear about from Agnes. Now, she did more than that. In 2017, she went on to become the first Vice Chancellor of the University of Global Health Equity. This is an institution that reimagines how health professionals are trained, combining science with compassion and ensuring that equity is not just an idea, but a practice. Through this work, she's inspired a new generation of global health leaders to center justice and humanity in all they do. Beyond her national service, she's helped to shape global health policy through a variety of ways. She co-chaired the United Nations Millennium Development Global Task Force on HIV/AIDS and access to essential medicines. She served on the boards of the Rockefeller Foundation, the African Union Commission for Infectious Diseases Responses, and the African Europe Foundation. She's brought science into all of what she does. She's been an advocate for women's leadership and the health of children, and in this area in particular, has been a large part of the more than 250 peer-reviewed publications that she has. She holds appointments at the University of Global Health Equity, the Harvard Medical School, Dartmouth's Geiser School of Medicine, and she's a member of the U.S. National Academy of Medicine, the World Academy of Sciences, and the African Academy of Sciences. Her achievements have earned her international acclaim. This includes recognition among the 100 most influential African women and the 2022 L'Oreal UNESCO Award for Women in Science for her outstanding contributions. She's contributed to these remarkable achievements by employing the vision, strategies, and values that we hope to build and project through our school, and is really recognition or representative of the Cameron Award itself. And I think as she's done this, she's projected the values that we see as really important in our new school in terms of training our leaders of the future. This involves focusing on key problems that can have sustainable effects on multiple other aspects of health. It involves doing this through an emphasis on improving health systems along with community action. And it does this with integrating leadership and science together. With this, I'd like to hope you'll join me in extending a warm welcome to Professor Agnes Binagwaho for the 2025 RCSI Charles Cameron Award recipient. Thank you.
Thank you for your kind words. I don't deserve all of that. And I want also to dedicate that to the hundreds of health workers, community workers, unfortunately not so many lawyers that I have worked with and to make it happen. So, dear leaders, colleagues, and friends, thank you for having me here today. And I have to admit that receiving this award increased for me and my colleagues that are not here, but they are going to watch because they are filming everything. So I'm talking also on their behalf, that we have done those actions together. So it is important because today, in too many places around the world, the past social gains for human development and well-being are at risk to be destroyed. Seriously at risk by some leaders who go against that or against the budget to do that, say that there is not enough money, that it is costly and not value for money. So let's tell you a little bit about me. I'm a Rwandan, as you have said, and today, too much of the world still continue to know my country in the context of the horrific genocide against the Tutsi that took place in 1994. So, the Rwanda of today, it's far from that. It's a beautiful country, and we call it the country of the thousand hills, and it's full of optimism, hope, and progress. We, of course, didn't forget the horrific past we have had, because we know that if it has happened, Rwandan people are not bad people. If it has happened, it can happen again. We need to be very careful of the leaders we allow them to lead us, and of the law we allow our parliament to pass, etc. So, together, we transform Rwanda in a very promising country. And we succeed because this was a collective choice made in a participatory process after a long and deep national consultation. Long? 2 years. After the genocide, the leadership at that time, and it was the army, say, we stop everything. We don't go for tribunal now because judges were killed, there were no lawyers. Remember that the genocide started by killing, remember, 3 Jesuit pastors that were against the killing. And after that, they killed all the people who were educated, who could convince the population not to participate to the genocide. So after the genocide, the country was really deprived of people who could lead them quickly. And the great majority of Rwandans responded to the task and decided to create everything anew. There was a deep discussion, and the victim of the genocide, the survivor, those were the family who had their family killed, were the most people we have to be grateful for their patience and agree not to revenge. And especially the women, because men were killed and women were remaining alive, saying, you will suffer more alone than if we kill you now. So we create a new approach to governance, a new approach to communication, a better way to give position to each and every one, especially the women, the poor, and the vulnerable. Opportunities were shared differently with the objective of leaving no one out. This sentence is very key because previously it was based on exclusion of a portion of the population. Make sure that each and everyone understand that we leave no one out because there was not everything for everybody. Rwanda was a poor country. Like we had, at that time, 100,000 people, roughly, because those were projections, in need of treatment against HIV. But we had only 3,500 doses a day. So how to make a choice, avoiding that I treat all my family, etc., my friends, we put that in the end of the communities, creating association with women, youth, the little public sector, private sector that was there, who decided who will receive the treatment to avoid favoritism. So, as I say, we create a new approach to governance, to communication, and we share opportunity differently. We really turn the country apart with this approach. But thank goodness that Rwanda at 1996 was a forgotten part of the world, because when I came back, I came back for family reasons. If I was alone, I'm not sure that I would have came back. I don't know, I'm not sure. But I came back for family reasons, and I saw more death in 24 hours than in all my practice 10 years before. And I remember sitting on my bed and say, I will not cope with it. But thank God there were no flights that day. So I just have to sit on my bed and think. And I thought in the middle of the night, so if people like me, healthy, I eat every day, I can move, run away, who is sane? Who will change the life of those kids who are dying anyway? And dying for preventable and treatable diseases, meaning they just need to have people who can implement what the world knows scientifically. So I reflect on the way forward, and I decided to stay. But it was not easy. Just because we didn't have, I knew what to do, but I didn't have the means to do it. You cannot treat malaria without anti-malaria. And I'm not the one importing drugs. I'm not the one buying the drugs to distribute to the people. So the first thing we had to do was to create systems. System for national procurement, system for national distribution, system for money recovery, system to make sure that the poor that could not pay are cared for. And I just want to tell you that we had to work everything to make sure that the patient in front of us can receive the treatment that could save their life. So, when I decided to stay, I never looked back. I have to say I never regret. Not because it was easy, but because every day I could count the change I have made. And there is nothing that fuels better you that the achievement you can recognize. Many people are doing good things, but they cannot put the point on what. I could put a name, an age, a number to the people I have helped to save that day. So I was sleeping well, I have to say. It was very hard, but I was happy. So, knowing that equity was always my focus, I knew that I was doing my job when I saw people having better life, especially in the rural area, in the remote place of the country. As I told you, I didn't grow up in Rwanda. I didn't know really my country. But when I saw, I could know who are the poor, who are the rich. I can see who come from a rural area. But when the change can be noticed in a rural area among the poor, I knew that I have reached my point. So there were my targets. How to bring medicine system and save the poor in rural area. Because when the poor are served, the rich are served. Don't worry. They find their way. They know how to read. They know how to find things. Goods were in the cities, not in a rural area. So when you have managed to bring those goods there, you knew that the job was done. So we also had the problem of the people who have committed genocide. We were a population of 7 million. 1 million people were killed. It's not a little number. Knowing that they were killed not with bullets, they were killed with machetes. They were the neighbor killing the neighbors. People knew the people who killed them, and those who escaped knew who killed their family. So the big challenge was to work hard for no revenge. Just because if there is a revenge, there will be another revenge, there will be another revenge. At the end, you don't know who started, and you don't know how to stop it. The big challenge was also to convince the people that one day they will get justice in a system where there is no longer justice. There is no lawyers, there is no judges. There is no, the European way to give justice was totally destroyed and not ready to be rebuilt. It took how many years to have lawyers? It took how many years to create a judge? So we knew that we had to find another way to give justice. And we revigorate a past way to give justice called the gacaca. And gacaca was when there was a crime that was not a blood crime. People who stole the cows, the goats, things, the community come together and do justice, meaning they recognize the facts and they estimate the punishment. So we revigorate the gacaca that in the past was not aimed to punish or to judge blood crimes, and we adapt it. We make a law. So that means it passed through judges, lawyers, people come together, putting legal framework, because a law is not talking like everybody. I learned that. Lawyers are speaking their own language to say what you want, but they say it in their way. So they create a law that passed through the parliament, and all the country was involved. So that means the draft came from lawyers and judges, went to the community. In each community, it was discussed and come back with the change, go back, And when the majority agree of that, what was written, the law passed through Parliament. But because everybody has already agreed, there was no discussion. But it took 2 years, and I remember at that time we were working, but half a day a week, we were coming together to discuss the progress in that law. So imagine the number of consultations. I don't believe there is another law who took as much time to be settled and who had as many consultations. So when the law passed, everybody knew what it was about. Everybody knew the role they will have, and it was very easy to implement it. Now, after 1996, 7, 8, trial came. When the person trial disagreed, the community sent the case to a traditional court. When they still disagree, it goes up to the Supreme Court. So when it was easy, it remained at community level. And the objective was really people to believe that they got justice and to understand that it was in their hand. And this system that I advise many countries in trouble, and we have countries in trouble like Ukraine and others, is very, very effective. Because when what I want doesn't pass through, I know exactly why around me, because I know we discuss with people. It's not something coming from up. So we have to remain vigilant, because I totally understand that what has happened can happen again. We are in a region of huge instability. Rwanda, Burundi, Congo, Uganda, even south of Tanzania. For multiple reasons, for the gold that is there, for the diamonds that are not found, for multiple reasons beyond the people. But we need to remain vigilant, not to be trapped again, because part of those instabilities are created by the people who want local people to fight among themselves so they can have access very easily to diamonds and to other things. I say diamond like that, but there is other things. So this is what I want to exchange with you, knowing that when I came back and decided to stay, I was very lucky because, as I told you, every day I can count the difference I have made. And I remember one day I was so fed up, so tired, I want to run away and go in a place where I can sleep without thinking maybe this baby will be dead tomorrow when I'm come back, etc. But I thought to myself, what difference will I make if I'm going back to work in France where I am even not needed? They have enough pediatricians. If I'm not there, it makes no difference at all. And on the contrary, if I'm living here, at one time we were only 6 pediatricians for 12 million people. And among the 6 pediatricians, only 2 were true pediatricians. 2 of them were self-nominated pediatricians because they have worked with kids but not learned about pediatry. So that's what I want to tell you and to share with you, because there are many countries that are still in that situation, more than we think. In matter of inequities, there is no part of the world that is not concerned. We can see that in some developed country now, today. And you, here, if you are not vigilant, be careful. You don't know what tomorrow is. So this is my message. I'm very happy to be here. And I have to recognize with you that if we look at the world as it was 20 years ago, and the world where we are today, in matter of survival of the average number of the population, we all together have made great progress. Thank you.
Thank you, Professor, for that captivating talk. My role here right now is we'd like to engage in a discussion. We'd like to hear thoughts and comments and the opportunity for some questions. Maybe I'll start it off if I could. You know, I had the opportunity to read a couple books about Rwanda a number of years ago. And the message that I came away from it was kind of a harsh message, is that any society is capable of what happened there. You know, we know about this at different times in history, and we think, oh, it happened there, but only happens there. But the message that you get from that is that the events under the worst circumstances can happen anywhere. And it's what is, I think, what's really impressive and interesting about what you've described and what I'd read is this priority of putting reconciliation just a step before justice was a crucial decision that I think most places maybe would not choose to do. But what I heard from you today that I hadn't really thought of and read about is that in a way, the justice was being achieved through health equity. And so it was a decision, it's a softer way to achieve justice. And I'm wondering if, is that the truth, and is that the way it worked? And that's sort of my first question to you. And the second is, this is a society that was broken in all ways. You worked in the health system, but by leading with health and achieving equity as a form of justice, I'm curious, did that then affect other parts of the country? And if so, how? Other parts of the system?
I think there was not only doctors, nurses, the very few physiotherapists we had, and also the so many community health workers. We have 15,000 village, and we had at that time 2 community health workers per village. This is an army of people with a certain form of education, because they just know how to write and read and had no education. They just learn how to do an injection and dilution. That's it. And also fever, take the temperature, how to give acetyl salicylic and paracetamol. So they were just there for emergencies, but they were everywhere. And for example, they were the first to have a phone. They received, all of them, when they were recruited, received a phone, and many got the job to have a phone. But it's not bad, because their job, they were also elected by the community. It's the community who was saying, I want that one as my community health workers. I don't want this one, so we don't take. So they were elected by the community, so they feel responsible. The training was 3 weeks, very little time. And they were in charge of 80% of the problems with success. So that means us doctors, we are really make a lot of things of what we do, but there are people who can do. And I advise here in this type of country to have community social health workers to accompany psychologically people who feel alone, because this is another problem. But it can be done.
Very interesting. And I'll have one more follow-up question, then I'll ask for questions from the audience. And what you've described is the role of community, but different aspects of that, including community health workers as being essential, pairing them with more traditional elements of health systems. And I'm curious, in the aftermath of such conflict, what that did. Were there any problems in that approach, or did that contribute to the reconciliation?
It contributes to the reconciliation because, you know, what people want for their beloved is what? Health and education. We don't have winter, so no cold, no whatever. It's okay. You can even go naked. You will not feel cold. You don't go, but it's just to say that what people need was really to be fed and to be kept healthy and to have the feeling of security. You may be secure if you don't have the feeling of security. We have seen in some places at the border, when they have the sense that they will attack, they attack first not to be attacked. So they start the war when there was nothing. So that are the major thing that was brought. And that was brought by it was known and studied and brought by the political party. And it convinced the people to join the movement.
Okay, interesting. Questions, comments from audience? Okay.
I'll just stop.
Go ahead. I knew I could count on you there, Eunice.
Thank you. Thank you very much, Prof. It's absolutely an honor to be in the same room as you, and thank you for all that you did in Rwanda. While you were talking, you mentioned that you had to create systems. And I was thinking in my head, like, I'm a young researcher and I'm really passionate about equity. How did you come to terms to the gap between you creating those systems and the ill health that was still ongoing? You know, because in creating those systems, there must be a gap there, like the time it took to have them in place. How did you resolve that within yourself, that those people are still dying? I keep telling people are still dying of malaria irrespective of what we're doing. So how did you resolve that as a pediatrician, as a leader, and as a woman as well? Thank you.
So forget the word woman for malaria, because young men are also the most at risk. You know why? Because they are too proud to say they have a headache. And when they recognize it's most of the case, it was too late. So that means children under 5, pregnant women, and young men were a target for different reasons. So what I did, I told you, I still don't speak Kinyarwanda. I'm very bad. I was a minister 5 years and I don't speak my language. And don't be surprised. I told my president, you have two choices. Either I focus on language, either I focus on results. He said, we want results. Good. Huh? Kinyarwanda is a very hard language, and I'm not very good in language. And I had to learn English. Can you imagine? So I chose English, and that's it. I don't remember what you say.
While you were creating the systems, there was definitely gaps there. So there are obviously probably people still dying. How did you come to terms with that?
So I recognize one thing: I don't know my country. I don't have the culture to go and talk to people in the rural area. I don't have the same language. I don't speak Rwanda, but also I don't have the same way to see the world. So the first thing I did was to create around me a group that will look at what I was doing, inspiring the law. So I create what I call umbrellas. We had 10 representatives: the public sector, the private sector, the women, the youth, the religious. 25% of the health facility belong to religious, So you better have them to the table of discussion, and also they have a lot of knowledge. And who else? Those in charge of children. So all the constituencies that can help me to call quickly or to send a message. I put them around the table and we discuss each problem, each draft law. So they bring those draft law to their constituency and come back with change. So that means when the law leave my office for the Prime Minister office, it has already a national consensus. Did I answer your question? Okay.
Creating a network around you.
I create the network around me with the people who have the real knowledge. You don't have to be knowledgeable, to lead. You need to have knowledgeable people you follow. Because anyway, a leader is knowledgeable in one thing, and there are 100 things. So don't be pretentious. Bring people around you.
Let me go to Sarah and then Debbie thereafter. Oh, go ahead, Debbie, go ahead and take it away.
Hello, thank you very much. That was very interesting. And I'd just like to pick up on the point that you've made about the importance of community development. And Eunice, who's just asked this question, Eunice and I have been working in some of the most disadvantaged areas in Dublin. And we have the same experience with the communities. They're really knowledgeable about what they need. They're very clear about those needs and how those problems might be solved. The problem that we have is the politicians, and within the health service, an emphasis on lifestyle and behaviour change, what people need to do to improve their health. So they need to stop smoking or they need to lose weight. And actually, as you said, one of the major problems that these communities have is that they don't feel safe. They have a really serious drugs issue in the communities, a whole host of problems, people who don't want to go and pick their pensions up, whatever it might be. And we want the community to be listened to by the politicians, but they understand community development to be consultation, so that if they take an idea to the community and tell them what they're going to do, that's community development. So I just wondered what what advice would you give to us, to these politicians that are saying, we're putting the resource in here, we want to know what the key performance indicators are up here. And as you know, it doesn't work like that. How can we convince them that they really need to take on board what the community is saying and not just this kind of very brief consultation with them that really is not very meaningful?
Remind the community that they are voting for those leaders, and they should not if they don't listen to them. Help the community to have key performance indicators for those leaders. Do they listen to us? Are they concerned with what we propose? Do they try? Because sometimes it's not possible. Do they try to implement? If not, let's campaign against them. You have no other choice, guys. Because politicians, they are good, they are for the people, or they are there for themselves and they will fight to stay.
Thank you.
Thank you, Debbie. Let me go to Sarah. Did you?
Thank you. Thanks very much for being with us and for your presentation. Mine is a kind of a similar version of Debbie's, just from a slightly different perspective. We've in the last few years we've launched a master's which is all about population health leadership, and I suppose one of the tenets that sits behind it is a kind of a redistribution of skill and responsibility and power right across the community. So it's a slightly different version of the same question, Debbie, about, if I've understood your presentation, in a way, a lot collapsed so that you could rebuild in a very different way.
We don't succeed because we collapse. We succeed because we organized.
Interesting.
Yeah, because people say, oh, they succeed because they collapse, so I cannot do something before I collapse. No, 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 no. We fight to organize.
And that's my question really, is that, you know, we have a very established system. It's not going to change anytime soon. And therefore, yes, just some advice around how to enable communities to become more empowered. You know.
By giving the true information and also remind the people that those who are there are supposed to be elected by them. Now, I know that democracy are very strange, is a very strange animal. So many democratic countries are not exercise their democratic rights by not going and vote, by letting the country be devoured by people who doesn't represent the majority. But tell the people that this is the problem, that when they don't exercise their democratic right is like not having a democracy. And if they want to influence the leadership for a better life, they better exercise their democratic power. Having democracy and not using it is as bad as not having democracy.
Go to Cahill. Go to Cahill and then.
Thank you very much. My understanding was at the time of the genocide, media, particularly radio, was used to incite a lot of hatred and violence. In a democracy nowadays, we're all concerned with the impact of media nowadays, social media, in inciting unrest. Any lessons to be learned from how this is managed in Rwanda?
So, whatever you do, you need to do that legally. If not, you have no power. So the first thing was not to be concerned by the radio and all those things. We were concerned by making the promotion of division illegal. Thanks God we did that in a way that didn't saw us coming. But when it was voted, then we start going to the radio and social media and all those things and make it, well, the implementation of that is what has made the difference. But if they see you coming and they are powerful, you may not succeed. So you have to be very strategic. I don't know if I answer your question.
Answer the question. Yeah.
Nothing out of the law. The law is your best friend.
Thank you so much for this lecture. It's been very personal to me. I was literally taking notes for what to do. I'm Sudanese, and this is really coming on a very critical point in time for my country and what its future might look like. And understanding what has happened in Rwanda, because Rwanda is a very important example for post-conflict, post-crisis scenarios, successful scenarios. In the case of Sudan, it's really the contrary, is that Sudan is a huge country. It's a massively huge country. It was the largest country in Africa before 2011, when South Sudan came into the map. And now it's becoming a really critical point as of this week, where things have escalated massively. This is going to the history of the country and the polarization that has happened over the years, and that allowed the massive cracks that you have rightly described, where external forces had the optimum opportunity to come and get involved in the country and create an unprecedented escalation of the the conflict, that has also led to more polarization of the country, which already had so many reasons to be divided within through regions and historical power dynamics, etc., etc. So as of today, there is so much polarization in a massively huge country that is very politicized. Even the lay person in a market in Sudan would know exactly how the politics are and would go into a very deep political conversation with you. So it's heavily politicized. That is also adding to the polarization of the country and the depth of the crack within the society. In that scenario, I would love to hear your thoughts about what can be done in that situation. People, the brain drain is there, of course. People have left the country but have never left the political scene, so they do contribute to that. Oppositions, hundreds literally of political parties getting involved in that, creating more cracks, creating more division, more than ever. So I would like really, in light of what you have witnessed and contributed to in Rwanda, what do you think is your advice, I would say, on how to go about this and how to create unity in such a huge country such as Sudan? Thank you so much.
Cannot, but if you come with others, you may. I don't say you will, you may. So with this language, you can approach other groups. Approach groups as women is a very useful approach because women are, let's say they have less testosterone. Huh? So they don't have so much to make a point and to be there. Eh? So that's the only way. Convince the leaders of those groups that a unified Sudan may be far better for their kids than what is there now. And that you can achieve it if you all come together. But to go to them, you need to have a solid plan. What are you proposing? Which plan with a budget and some ideas where the budget will come from? And when you don't have an idea, just say, I don't have an idea for this, but maybe we can come together and find how to do that. So having a plan, target the people who are ready to listen to you. Try to introduce yourself through other women. They are very good men too, but you have to. You will never do that alone.
I'm being signaled here that we're pushing the time limit here. Maybe if I could just close us with, and permit one other question, just to pivot briefly to the future. We've talked about the lessons from the past and recent. Is there, we're in an era now where it's not just HIV, child mortality, it's non-communicable diseases, it's new problems emerging. And I'm curious, do you think that, how does Rwanda sit now and have the lessons and what's been learned in that period? Has it set it up well now? And what are the challenges going forward?
So using what's working, that means the community health workers. We have started to train them for non-communicable diseases and mental health. Because with the way the society is going, so far, it is anyway the Western world model with nuclear families or smaller families, but it's nuclear at the end. And with working parents and children by their own a long time. So we are training the community health workers. We have had one community health workers for all the under 5 causes of mortality, for pregnant women, and now aging population.
Okay.
We have to think about, because we start to have people living longer. In fact, always, my grandma died at around 100. So we always had people living longer. But now we have a bunch of more people living longer. So that we need also to educate about the other type of diseases, etc. So there is a lot of work to do.
Thank you. And I think we're going to have an opportunity after to engage and ask questions. I'm sorry we didn't get to a couple but at this point, I'd like to invite Ms. Tracy Robson up to close the session for us.
So, Professor Greg, thank you, and Professor Binagwaho, really, really fantastic and excellent discussion. So I'm now going to ask Professor Binagwaho to remain on the stage and to invite Professor Deborah McNamara, our President, to join us up on the stage. So, population health and health services is one of RCSI's priority research clusters. Since the launch of the School of Population Health in 2022, our ambition has been to position the university as a global leader in population health science through impactful education, research and collaboration. In 2025, the school is thriving and increasing breadth and depth. New postgraduate programs in population health leadership, as we've heard, are responding to the need to shift left for population health. Students from around the world are being equipped with the knowledge to speak to the myriad components affecting health populations, as well as developing the leadership skills to implement change. The school also plays a central role in delivering population health education across RCSI's undergraduate and postgraduate degrees. The school's scientific and research programme is going from strength to strength, with a growing portfolio and increased funding in areas including diabetes, stroke, cancer and other chronic diseases, women's health, health inequalities, epidemiology, healthcare outcomes, biostatistics and data science, digital health and global surgery. Like today's awards ceremony, the pioneering spirit of Sir Charles Cameron has also an influence on the growth of the School of Population Health. The Cameron Scholars Programme, established in 2023, represents a strategic investment by the university in the space to build and develop a comprehensive and impactful programme of education and research. The Cameron Scholars team, together with colleagues across the school, are working to ensure that population health research and education translates into real-world impact. The Cameron Scholars Programme is not only a strategic investment in population health, it is a catalyst for innovation, collaboration and leadership in population health science. So, Professor Binagwaho, in recognition of your pioneering role in global health equity, social justice, and for your leadership in Rwanda and beyond, it gives me great pleasure to invite the President to present you with Cameron Award for Population Health.
Thank you. It will push us to do even more.